Hello, welcome to this YouTube video. My name is Hannah. I'm a UK registered nurse, university lecturer, and I've been an NMC OSCE programme lead. If you're new to my channel, I share my teaching, advice, support to help you self-study for your NMC OSCE exam for free. Please like, share and subscribe. So I had a request in some comments to do a fall and fracture assessment verbalisation demonstration. So I'm going to do that today. So I'm going to put the clock on and I'm going to go through the station. We're going to do key principles, A2 assessment, News 2 and holistic assessment. So just remember our fall and fracture. So normally fractured neck femur. So just remember with this patient, they're going to be preoperative. They're going to be on bed rest until they are post-op and that fracture is being fixed. So it's very important to think about that in your assessment station. They're going to be on strict bed rest. They also might have some pain. We need to make sure, because of that bed rest, we're supporting them with all the activities of daily living, so toileting, personal hygiene, meals as well, if they're not nil by mouth as well. We might also be thinking about the cause of the fall, so if there's history of dizziness, antihypertensives, mobility issues as well, and thinking about the social side, so in terms of do they need physiotherapy, post-operative, occupational health therapy for the home, and referral post-operatively as well. So those are kind of some of the key main issues. So I'm going to put my clock on. I'm going to put 18-minute timer on because I'm not going to wait the full 60 seconds for respiratory rate and pulse because it'll be a very boring 60 seconds on YouTube for you. But you must do your respiratory rate and your pulse for full 60 seconds each. That's really important. So I'm just going to stick on a 20-minute timer. And I'm going to talk through these and do all the verbalisation. Like, you know, the practical, you guys know how to put a blood pressure cuff on, you know how to put SATS probe on. You don't need to see that. What you need to understand is all the verbalisation and everything you need to hit in order to pass that OSCE exam successfully. Okay, just a reminder, you do want to start your station by having a quick read through your paperwork. Very important before you go in with your safety and starting your station. So I'm going to start my clock. Okay, so I'm having a quick look. So I've got Reginald brought in from home, tripped and fell, sustained fractured right neck femur. He had pain, unable to weight bear. Was given IV morphine in the ambulance, and X-rays confirmed a Garden 2 hip fracture requiring internal fixation. So he's had pain in his hip, inability to stand or walk following the fall. Is feeling anxious about the admission and surgery. As Reginald's normally very independent and is very anxious about loss of independence whilst in hospital. He has a walking stick, but his daughter reports he does not like using it. He has history of feeling dizzy. Okay, so that's quite important to pick up on. Hypertension, benign prostatic hyperplasia, so increased prostate and urinary frequency. So you might want to pick up on these things as well. Because he's going to be bedbound, so just making sure his toileting needs are met. So he lives alone. So wife died 6 months ago, so we just want to check in with that as well. Now holistic, lives in a bungalow, got 2 steps to the front door. Son and daughter lives nearby, visit 3 to 4 times a week. So he's got good social support there. He's got a cat. Just want to check that's being looked after. Non-smoker, drinks a little bit of whiskey in the evening. Can walk unaided. Medication history and no allergies. Okay, so I'm going to check the scene for safety. I'm going to make sure there's no hazards, and I'm going to make sure that the scene is safe for me and my patient. I'm going to approach my patient. I'm going to maintain privacy and dignity, close the doors and the curtains. I'm going to decontaminate my hands with the World Health Organization 7 steps. So palm to palm, palm on back of hands, fingers interlocked, fingers interlaced, palm to palm, fingers interlocked, thumbs, fingertips, and wrists, and allowed to dry. And I'm going to introduce myself. So, hello, Mr. Patterson. My name is Hannah. I'm the nurse looking after you today in the emergency department. I know you've come in with a fall and you fractured the top part of your hip. So I've come to do a full assessment of you, and I'm going to do some observations to make sure you're comfortable and ask you some questions around the fall and your health and social care. Before I go ahead though, can you just tell me your full name and date of birth? And I'm going to check that on your wristband first. Okay, thank you. So Reginald Patterson, date of birth 25th of the 2nd, 1941. I confirm that matches my wristband, which says Reginald Patterson, 25th of the 2nd, 1941, and my documentation here, which says Reginald Patterson, 25th of the 2nd, 1941, and there's a hospital number of F549087, which matches my wristband, which says F459087. So I've got the right patient. What would you like to be called? Reginald. Okay, Reginald, so I'm going to call you that. Do you have any allergies, Reginald? No allergies. So I can see that it's documented no allergies and you don't have a red wristband. Like I said, Reginald, I'm here to complete that assessment. As I said, just going to do some observations and ask you some questions on your health, social care and cause of your fall. Do you consent for me to do that? Okay, thank you very much. So I've got my equipment here, which has already been told that it's clean, calibrated and ready to use. So I'm going to start with my airway. So Reginald, I know you have been talking to me and I can see that your airway is patent. There's no visual obstruction. So I'm going to move on to breathing. So I'm just going to do a general assessment here, Reginald. I just don't want you to talk to me and just for a minute and just carry on as you are, just nice and relaxed there. Okay, so in my exam, I'm going to indicate to the examiner that my minute starts now. Once that 60 seconds is up, I'm going to verbalise my findings. So during that observation there, Reginald, I was actually just recording your respiratory rate, and your respiratory rate is 18, which is within the normal limits of 12 to 20. The rhythm was regular and the depth was normal. And whilst I was observing you there, I could see that you had equal air entry, that I couldn't hear any signs of any respiratory noises. There was no wheeze, no rattle, no stridor, no coughing, and I couldn't see any signs of respiratory distress such as use of accessory muscles, seesaw breathing, cyanosis, sweating. So I'm happy with your breathing. I would just like to check your oxygen saturation. So I'm going to pop this probe onto your finger. Have you got a preference? No, okay, so I'm going to use this finger, if that's okay. I can see it's clean, you've got no nail varnish on, no fake nails, and your hand's warm, so I'm going to put that probe on for you. Just going to let that settle, and I can confirm your oxygen saturations are 97%. So I'm going to document these down on my chart, on my bit of paper as I go. So I had a respiratory rate of 18, and saturations of 96%. Okay, so I'm happy with your breathing and I'm going to move on to your circulation. So Reginald, I'd just like to feel for your pulse on your arm here for 60 seconds. Okay, so remember again, you're going to wait your full 60 seconds. I'm going to verbalise my results. So your heart rate was 75 and the rhythm was regular and the depth was strong. So it was a strong regular pulse, which I'm happy with. And I just need to take your blood pressure, Reginald. So I need to pop this cuff onto your arm. If you've got a preference, which arm? Okay, so I'm going to use this arm. And can you confirm if you've had any surgery, previous strokes? I can see there's no cannulas or fistulas there. Okay, so I'm going to use that arm. So I'll make sure the cuff's the right size. I'm going to palpate your brachial artery and pop that blood pressure cuff 2 to 3 centimetres above your brachial artery there, making sure the arrow aligns. If you just put your arm at heart level onto this pillow, and I'm going to set that one off. And whilst that's going off, I'm just going to look at your other hand here, and I can tell you that you're warm and well perfused and there's no pallor. And I'd just like to do your capillary refill time, Reginald. So I need to press down on your finger for 5 seconds, and I'm just looking for the return of perfusion. Is that okay? Okay, so I'm going to do that now. So 1, 2, 3, 4, 5, 1, 2. So that comes back in less than 2 seconds, which is great. And now your capillary refill, your blood pressure is finished, and it is saying your blood pressure is 100/60. That's a little bit low, Reginald. Is that normal for you? No, okay, yeah, because I can see you're normally a hypertensive, so get that reviewed. Have you been feeling dizzy or anything when you've been standing up? You have, okay, that might be contributing to your fall. Are you drinking plenty? Okay, you don't drink very much, okay, because of your urinary frequency. Okay, I understand that. So I'm going to review this and I'm going to review your fluid balance. I'm most probably going to start you on a fluid balance chart as well. I'm going to let the doctors know. Okay, so I've done circulation, pulse, blood pressure, capillary refill time and pallor perfusion. I'm going to go on to disability. So Reginald, I know you've been alert and talking to me, so I just want to check you're not confused. So do you know where you are? That's right, you're in hospital. And do you know what the date and time is today? Yes, that's right, correct, well done. And just tell me your name and date of birth one more time. Reginald Paston, 25th of 2nd, 1941. Perfect, so I can confirm you are alert, Reginald, and you are not confused. Have you got any pain in your hip at all? So on a scale of 0 being no pain and 10 being the worst pain you've ever experienced. Okay, so your pain's two at the minute, and I saw you had some morphine in the ambulance, which is the good stuff, isn't it? So I'm glad you're comfortable. Obviously, you know, when that starts to wear off, or if you start to feel any discomfort, let me know, and we'll get some analgesics on board as well. We're most probably going to give you some regular analgesics so you don't get that breakthrough of pain. And examiner, can you tell me what the last blood sugar was on Reginald? 5. Okay, so that's within normal limits of 4 to 8, which is good. And Reginald, when's the last time you went to the toilet? Okay, so you went just before I came to assess you. Okay, I see from your notes that you have some urinary frequency. So do you often need to go to the toilet quite frequently? Okay, Reginald. So because you need to be bed bound because of your fractured echema, you can't get up and go to the toilet. That's really important. So I'm going to bring you lots of urinals and make sure you've got the cool bells. You can just use those so you don't need to worry about that whilst you're in hospital. Okay, so I've done conscious level, blood glucose, urine output, and pain. So I'm just going to move on to exposure now. So Reginald, I'm going to take your temperature with this infrared thermometer. I'm going to put that on your forehead, just making sure it's clean, about 1 centimetre apart, and I'm going to do that one now. Okay, so temperature is 36.5, which is normal, lovely. And have you got anywhere else any rashes, bleeds, bruising, injuries, wounds that I need to know about top to toe? Yeah, so obviously the bruising on your fractured neck, femur and your hip here, but did you sustain any other injuries in the fall? No, okay, so that's good. And I just want to confirm your past medical history with you. So I can see you normally have high blood pressure, your benign prostatic hyperplasia, and then your urinary frequency. Is there any other past medical history I need to be aware of? No, okay, so that's great. So that's all correct. So Reginald, I've finished the physical assessment. I'm going to do my documentation and then I'm going to come back and explain the results. And then I'm going to ask you a few questions around the fall and how you're managing at home and any other worries or concerns. Is that okay? Okay, perfect. So I'm going to go and decontaminate my hands now because I'm just going to pop away from the patient and do my documentation. I'm going to get my news 2 chart. I'm going to, normally the patient details will be filled in, but I'll check those on the day. I'm going to put the date, so 10th of the 11th, and make sure that's all in one box. Make that a bit smaller. I'm going to put the time, which was on my paperwork, of 0800. Okay, so we're going to start with respiratory rate, which was 18. So that is just at the bottom of my box here. Scoring a 0. My SATs for 96, which is here, just on scale 1. Patient is on air. We'll do an A in here. Blood pressure was 100/60. So 100 actually is here, just in this orange line here, and 60 is here. And I'm going to do my dash line. So I've got a 2 there for my blood pressure. Heart rate was 75. I'm just going to document that in the middle, the 71 and 80 box. Patient was alert. And temperature was 36.5, I think. Yeah, 36.5. So in the middle here. Okay, so I'm just going to calculate my news 2 score, which is just 2 because of the blood pressure is a bit low. Everything else is normal. So news 2 score of 2. Monitoring frequency is going to be, 4 to 6 hourly. So I'm going to put that in here, 4 to 6 hourly, and 4 to 6 hourly here. I am going to escalate this because of the blood pressure is quite low. Patient's been feeling dizzy, and I'm going to put my scores here. So Reginald, I'm going back to the patient. I'm going to decontaminate my hands using the World Health Organization 7 steps. And I explain my results. So Reginald, I've done your news 2 scoring. So your blood pressure is a little bit low, like I said. So your news score is 2. So I'm going to monitor you 4 to 6 hourly. I'm going to let the doctors know. So just so they can review your kind of fluid status and your antihypertensive medication, just to make sure that's safe. And I'm going to start you on a fluid balance chart, like I said. So now I just want to ask you some further questions, Reginald. So I see you had this fall at home. Is this the first time you've had a fall? It is. Okay. Do you know what caused it? Just felt a bit dizzy on standing up. Okay. And I see you have been feeling a bit dizzy. You said you're not drinking very much. Is that correct? Okay, so like I said, we need to look at that and see if we can just increase your fluid intake, either IV if you're going to be nil by mouth of theatre, or orally, and when you are kind of post-operative. And I see it says you do have a stick, but you don't like using it. Is there a reason for that? Just don't get on with it. That's fine. So once you've had your fractured fix, we will refer you to physio for rehabilitation, but also to give you some exercises, and we'll review you and see if we can give you a better walking aid to help. And if you're happy with that referral, I will also refer you to occupational health so they can come and do a home assessment before you go home, just to identify if you need any grab rails or support in the house as well. Okay, so like I said, Reginald, you're going to need to go to theatre. It's very important you stay on strict bed rest. So I'm going to make sure you've got the call bell and all your belongings are nearby. And like I said, you've got these urinals. I know it says you're a little bit anxious about theatre, which is quite normal, but I'm going to make sure we come and we explain everything correctly to you. We're going to prepare you safely. The surgeon's going to come and talk to you as well. Okay, I'm going to give you information about what to expect before theatre and post theatre. Normally within 24 hours you can get up and about as well post theatre. So I just see that your wife has died very recently and you've been married off for such a long time. I'm so sorry to hear that. It must be really difficult to be by yourself. But I see your son and daughter and son-in-law live nearby, so they visit you quite often. But do you want any additional support? Or is there anything that we can do just to help you at home, or to provide any companionship as well with any support groups or bereavement support? Okay, yeah, I see you've got your Pickles. Is your cat Pickles? Is your daughter looking after your cat whilst you're here? Okay, that's great. And she knows you're in hospital, doesn't she? Okay, so are you happy for me to call her so you can have a chat with her as well, and for her to visit? Okay, that's great. See that you don't smoke, that you do like to drink a glass of whiskey in the evening. That might be a little bit contributing to your dizziness and falls as well. So you know, I just advise you maybe to try and cut down on that if you can, and we can give you some support if you want to. And I see that you like being independent and being out in the garden, which is great. Like I said, once you've had your theatre and everything goes well, then you'll be able to get up and back to independence, hopefully. So have you got any other worries or concerns before I go? Okay, do you have any spiritual or cultural beliefs that I need to know about in preparation for theatre and your hospital stay? No. Okay, thank you so much, Reginald. So just to summarise, I'm going to discuss with the doctors about your blood pressure. We're just going to get that checked. I'm going to start you on a fluid balance. I'm going to ask the doctors to review whether IV fluids or seeing when your planned theatre is, whether you need to be nil by mouth. I'm going to get the surgeons come and talk to you about the operation so you know exactly what to expect. And in the meantime, if you've got any questions, just let me know. I'm going to make sure you've got the call bell and some urinals, and we'll make sure that all your personal belongings are nearby. We want you to keep still, keep that leg in alignment, which is important, and we will just come and reposition you to help you with your pressure relief care as well. Any pain, or if your pain starts to come back, you let me know and we will give you some regular analgesics as well. Do you have any other questions before I go? No, okay, so thank you so much, Reginald. I'll be back shortly as well to check on you. So I'm going to finish my station with my 7 steps to hand hygiene. So palm to palm, palm of back of hand. Fingers, palm to palm, fingers interlocked, fingers interlocked, thumbs, fingertips, and wrists. And I'm going to finish my station. So that was a fall and fracture. Pre-op preparations, again, just thinking about that holistic assessment, causes of the fall, support at home, identifying any potential pre-theatre anxiety, making sure you've put things in place in order for that patient to be bedbound and safe as well. And just you've got to get through it really quick and slick, and that comes through a lot of practice as well. But think about your patient, think about the condition, think about what they will need, and demonstrate your nursing knowledge and skills. So I hope that's helpful. And thank you to the person who's requested that. So I hope this is helpful to you as well. Like I said, do tutoring, one-to-one tutoring. If you want some additional support for your NMC OSCE exam, please do feel to get in contact with me. The details are below in the description.